topic is entitled 12 Causes of Low Pulse Rate. When we talk about low pulse rate, sometimes we say low heart rate. Medically, it's described as bradycardia. Here, our heart rate naturally is supposed to be between 60 times per minute to 100 times per minute. Okay, so normally if your heart rate is about 100 and more, it can weaken your heart, it can cause problems. And when your heart rate is also below 60, it may 50 something, 49 and so on, that is called low pulse rate, that is bradycardia. That can also cause real serious problems for the person. Some of the problems that low pulse rate can cause are complications, and including, in fact, it can be symptom on its own, is that the person can be fatigued, and it's a complication as well. Fatigue all the time, or dizziness, or fainting. It's called syncope. It means the person not receiving enough blood to the brain, so the person can even faint. And the shortness of breath, angina, it means pain in the heart. And then cognitive impairment, it means the person not having enough blood to the brain, so there's a brain disorders like memory problems, confusion, and lack of concentration. In fact, low pulse rate can cause a complication like heart failure, and even to greater extent a cardiac arrest. It means your heart can stop beating suddenly. All right, but you see, there are a small group of people that if their heart rate is below 60, it's not a problem. These are small group of people like the athletes, or people who are they are physically active. When you are physically active and you have a low pulse rate and you don't have any symptom, of course, because you're physically active, blood goes into your brain and other organs, so you'll be all right. But majority of people with a low pulse rate are not physically fit, or they are not physically active. So the symptoms, I've mentioned them already. That is the feeling fatigue all the time, dizziness, shortness of breath, chest pain, that is angina, memory problems in the long term, and the people that will get angry easily, okay, and confusion. But what are the 12 key causes? Let's listen to the 12 key causes. Number one cause here is aging. But aging doesn't mean that you automatically have this problem, but it depends on how you feed your heart cells or your heart. If your heart, you feed it with the right nutrients and exercise and good night's sleep, okay, that will keep your heart healthy, and your natural pacemaker will be producing enough good electrical signals to regulate your heart rhythm, okay, and then you wouldn't have any problem with low pulse rate. But unfortunately, it doesn't happen to many people. So aging is another issue here. Number two is heart block. Heart block means that your heart actually, the pacemaker that is in the upper chamber of the heart. The heart is up two upper chambers and lower chambers. So the heart, the natural pacemaker will send signal. It's supposed to go down to coordinate with the lower chambers, but it can't travel easily. So if it can't travel easily down, it's called AV block or heart block. It can cause low pulse rate. Number three is heart disease, like ischemic heart disease or coronary artery disease or heart failure. This can cause weakening of your heart muscles, which can affect the way the pacemaker, your natural pacemaker, releases electrical impulses to regulate your heart rate. So it can cause low heart rate actually. Number four is hypothyroidism. It means underactive thyroid. That is when your thyroid is not releasing enough thyroid hormone into your blood. That can make your heart rate also, or you have a low pulse rate. Number five is sleep apnea. That when you sleep at night, there could be cessation of breath for about 10 seconds. It could happen about 5 to 100 times before daybreak. Only your husband or your wife sleeping next to you can see this. That can cause also low pulse rate. Autoimmune disease like lupus or rheumatoid arthritis can also cause low pulse rate. Number 7 is low body temperature. It can also bring about low pulse rate. Number 8 is electrolyte deficiency, that is imbalance of calcium, magnesium, potassium. Maybe the person has a problem with the kidney, or the person may not be taking enough nutrients. That can also happen. Infections is number 9. Bacterial infections that causes strep throat can also affect the heart, especially the heart valves, which is like a door which regulates one way of flow of blood within your heart. It can also cause a low pulse rate. Number 10, listen carefully, is about medications that are given in the hospital for blood pressure. Medications for heart failure, medications for arrhythmia of the heart can also cause low heart rate. And remember, if you have low heart rate or low pulse rate, it can also cause heart disease. So you're taking medicines for heart problems, but it will also in turn cause heart problems as well. Number 11 is heart surgery. When you have a heart surgery, it can also lead to this problem, especially if the electrical system, conduction system is affected. Number 12 is congenital heart defect. Some people are born with a heart defect, but it's not a common thing. It's a rare case. So now we've known the 12 key causes of low heart rate. If you are interested in more of my videos, short videos, please go to our YouTube channel, put in Dr. James Natural Link, Dr. James Natural Link, and subscribe and share the videos there. Be a blessing to somebody, and God will bless you. If you have any chronic disease and then you need help, or somebody needs help, share this number. Be a blessing, and God will bless you. Is calling outside the UK is +44 738 464 7300. If you're calling within the UK, is 0738 464 7300. Thank you so much